Good afternoon, everyone. I can't believe that we're filled with so much energy. I was going to say food, but I reserved that. Good afternoon, everyone. Thank you all for coming back. This is the third program in the series. This afternoon is entitled Medical Emergencies, and we have our two distinguished guests with us today. Dr. Fowler is one. The other young lady, I believe Dr. Fowler will introduce when she comes and stands where I'm standing at the moment. However, thank you all for coming. I guess for myself, I've experienced medical emergencies before. Some of you may never, hopefully will never experience anything remotely like that. But in the same breath, we've got a professional here who will be able to give us an insight as to what it entails and how best, I guess in a sense, we can prepare best in case it does happen. Before we start, I'll ask that we stand, please, wherever you can. Shall we pray? Gracious Father, thank you yet again for another day, your love and your continued mercy. I'm about to go into this program, dear Lord. I pray that you'll touch the presenters. I pray whatever they have to present to us, that it will be beneficial, be able to use it, Lord, not only for our own benefit, but also for those who we serve in our community and within our homes. We pray in Jesus' name. Amen. Amen. Shall we be seated? As I mentioned earlier on, today we have Dr. Fowler with us. She'll give us her surname and a little bit more about herself when she comes to the table, or come to the podium at least. But one thing for sure is that this lady is full of knowledge. We work in tandem, work side by side over at Newham Centre for Mental Health. And the information she's going to give us today, I know it's going to be tangible and practical. We're about to use it. So at this moment in time, I'll ask Dr. Fowler to come forward. Thank you.
So good afternoon, everyone. Thank you, Uncle Clement, for presenting for me. So my name is Dr. Kazim. I am currently working at the Newham Centre for Mental Health. I graduated from Durham and Newcastle, used to have a joint medical school. So I graduated in 2020. I don't know if everyone remembers what was happening that year. It was COVID, so I began my medical career just experiencing COVID and dealing with a lot of medical emergencies. My goal is to become a GP, so I'm in the second year of my GP training at the moment. So God willing, in about a year and a half's time, I should be a fully qualified GP. And hopefully continuing to work in East London for some time. Thank you. So today I'll be presenting on medical emergencies, and this is very important for a variety of reasons. I will show you this when the presentation comes up. So why does this topic matter? 72% of cardiac arrests, this means when the heart suddenly stops, actually happen at home. I think a lot of people think it happens in hospital, but the vast majority happen at home. About 15% occur in the workplace, and the rest of them occur in hospital. Now, about half of all cardiac arrests are witnessed by a bystander, so someone else is present. And people can have cardiac arrests for various reasons. Often, one of the most common reasons will be when people have long-term conditions, and that causes their organs to not work as well and may cause things like cardiac arrests to happen. These long-term conditions such as diabetes, heart disease, etc., are increasing in general, and especially amongst our community, amongst the Afro-Caribbean community, we do tend to have higher rates than the white British population of these sorts of conditions. And it's useful and empowering to know basic life-saving skills because you could save a life. I'm sure lots of us in this room have probably experienced medical emergencies, either, for example, at work, if you do work in healthcare or social care, or even personally. My uncle, for example, he's now passed away, but my cousin was there at the time that he was unwell and had to kind of perform CPR. So actually, it is something that's a little bit close to home, and also I have experience as well from a medical perspective as well. So hopefully this is useful. I've got lots of slides. We'll see how much we can get through, and we'll try and keep all the questions to the end. But if you have anything that you really wanted to ask or that you thought is very important that you would like to broach, then please just put your hands up. And I think we have someone with a microphone potentially here, and then they'll be able to help those questions. But we'll try and keep questions till the end. Okay, so does anybody know this acronym, first of all? Doctors ABCD. This is to try and help us remember what to do if we deal with a medical emergency. So D is for danger. We look around for danger, first of all. Whenever you're approaching any situation, it may be in the home, but actually it may be outside on the road. Is there a car? Is there someone with a weapon? Is there water around that you can slip on? It's important to bear that in mind. Next is response. So the person who, for example, has collapsed or who is unwell, we want to get a response from them. So first of all, you start off by speaking to them. So if you know their name, you can say, Mr. Jones, can you hear me? If they're not responding, then we go to the next stage, which is you actually tend to, for example, squeeze them on the shoulders, and this tends to wake people up because actually, if you do it to yourself, you can't really feel it because it's the same as tickling yourself, but it is quite painful if someone were to squeeze here on your shoulders. So if someone's not waking up after you've spoken to them, you can squeeze them here, and usually if they are awake and they haven't lost consciousness, they should wake up. Then send for help. It's always important to get more help. It's hard to do anything by yourself. When we're dealing with medical emergencies in hospital, we get as many people as possible. We press the big red buzzer or we start shouting for help because you need as many hands on deck as possible. And then I'll go on to these bits afterwards, but the main things that are going to kind of end someone's life are checking their airway, their breathing, and their circulation. So those are the first most important things that you want to look through. So airway, breathing, circulation, or CPR as well, because CPR is how you kind of get the circulation working again. And then defibrillation as well. So I don't know if some people have seen the kind of AEDs or the defibrillators that you can have out and about. I'm not sure if we have one here, but they do tend to have them more in workplaces now. So the first medical emergency I'm going to speak about is probably one that is the most dangerous, and it's a collapse or an unresponsive person. So I've already said the doctor's part of ABC. Danger, check around for signs of danger. When you're on a plane, what do they say? You put on your own oxygen and everything before someone else is. If someone is in a dangerous situation, you can't approach them. You have to look after yourself first of all. The second is response. So as I already mentioned, verbally, are they responding to you, or pain or pressure, we call it, because we don't want to think that we're causing someone pain, but essentially squeeze here, try and wake them up again. If they're not responding, you send for help. You shout for help, you call 999. The ambulance crew will talk you through what to do next. I will be speaking through what you do next, but also it's just good to kind of bear in mind that the ambulance crew talk you through. So if you have a phone and you've called them, put it on speaker and they will talk you through the next steps. So the first step is airway, like I said. So this is the airway. It's the part of our body where all the kind of the air obviously goes into our bodies, because the main thing that will end someone's life is if you don't have enough oxygen circulating. So airway is how we get the oxygen in. You need to make sure that the mouth is open, that the kind of throat is open, and that oxygen can get further down into kind of the lungs, so the breathing system. And then there's circulation, so the heart as well. So oxygen, again, we get through the airway, it goes into the lungs take in the oxygen, and our heart pumps it all around our body, and that is the main thing that keeps us alive. So in any situation where you think someone's collapsed, these are the main three things you have to check, first of all. So how to check them? The airway. Oh, yes, go ahead.
Okay, yeah, that's the main three things, but I think they should put in the recovery position.
Oh, so that's what we're going to come on to that, yes.
Yes, the recovery position, and then for they get the airway clear and things.
That's exactly what we're going to come on to. So first of all, to check if you should be doing the recovery position, what we should do actually is check if the person's breathing or not, because that changes. Sorry, someone was saying something.
No, when you say check if the airway is clear, isn't that when the person is lying down, see if the person, you tilt the person's head back?
Yes, exactly. We're coming on to that.
Yeah.
Yes. So that's very important. I'm glad that people are already aware of this. So is the airway clear? You can look in their mouths to see if something's in there. We do say, though, that if they've got, a piece of food or something in their throat, I know it's tempting, but there's no point in you trying to put your hands in to take it out, because actually what you end up doing sometimes is pushing it further back and blocking the airway further down. So if you see anything in there, it's difficult when you're at home. In hospital, you have sorts of, like tweezers that you can take them out with, or you have suction, but in the home environment, we say just don't try and remove it. You would move on to later steps. But what you can do to keep someone's airway clear is you put a hand on their forehead, you place 2 fingers underneath their chin, and you tilt their head back. And that keeps their airway clear. This is when they're lying on their back, by the way. So you do that, and that keeps the airway nice and clear. So gently tilt the head back. Breathing is the next step. So we've checked the airway, and we've made sure that the airway is clear. Now, are they breathing? How do we check for breathing? we place an ear over their mouth, and we listen, and then we look down at the chest. So we're feeling and listening for breathing with our ears, and we're also looking at the chest to see if it's rising. We say it's good to check for 10 seconds because over 10 seconds, someone should be taking breaths. So check for 10 seconds. And then the next stage is circulation. With circulation, we say that nowadays, if you are a bystander, so you're someone at home or who's not kind of trained in CPR and this whole situation, you don't need to check for circulation. The main way people do it is by checking, the big pulse here, the carotid pulse. If you know how to do it, then you can do it. But actually, we say it depends if you know how to. If someone isn't breathing, we go straight to what I'll show you, which is CPR. You don't necessarily need to check circulation, only if you know how to do it, because it's not really going to change much for you. I'll explain that hopefully a little bit better in a moment. So if they are not breathing, we perform CPR. CPR stands for cardiopulmonary resuscitation. Cardio, heart, pulmonary, lungs, and resuscitation means bringing someone back to life. And I'll explain a bit more about CPR in a moment. But if they are breathing, then we do the recovery position. So remember, we've done doctors ABC. What we've done is we've checked for danger, response, we've shouted for help, we've checked their airway and made sure their airway is okay. We've checked for breathing. If they are not breathing, it's CPR. If they are breathing, but they're still not responding to you, then it's the recovery position. And I'll go into both of these now. So recovery position for breathing. So not breathing is CPR, and we can use a defibrillator. We have a video as well, which will show you a little bit more how to do it. It's quite difficult to demonstrate unless I were to have a person here with me. But essentially, you kneel next to the person, you interlace your fingers, so you bring your first hand like this, and then you lock your other fingers in, and you put that on the breastbone in the middle. And once you put that on the breastbone, you want to keep your elbows nice and straight. You don't want to bend them, and you're pressing down with the force from up here. So if everyone could just do this for me. So first hand up, and then second hand, lace it in like this. Elbows nice and straight. And you're pressing down, and the weight is all coming from here. This is where it comes from. And this is where you press. And you put it on their breastbone, okay? Fine. Can we see the video as well, please?
Microphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand centered on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive."
Perfect. Thank you. So that should be enough of the video. So yes, Staying Alive is a really useful song. Obviously, it sounds a bit ironic, but it gives you the exact beats that you need. I actually also help to volunteer sometimes teaching young people, so people kind of between 16 to 25, how to perform CPR, and none of them know the song Staying Alive, which is quite shocking to me. So apparently it's not for the younger generation, they don't know it. So we just say if you do know any songs that are between 100 to 120 beats per minute, and some people are, they like to DJ and things, so they know, that's a good song. But Staying Alive is a very good beat. You want to make sure that when you're pressing down to a third of the depth of the chest. So however long the person is, it's about a third, 5 to 6 centimeters we say. And when you press down, you want to wait for the chest to come back up again afterwards. Because what does your heart do? It squeezes and it relaxes, it squeezes and it relaxes. You're recreating that. So you're pressing down, you're essentially squeezing for the heart, and then you're relaxing to let the heart come back up. You keep doing this, and can anyone tell me, when you're performing CPR, when do you stop? When help arrives and someone can take over, yes. Or if the person miraculously wakes up. But essentially, you don't stop until someone else can take over or the person wakes up, because you are replacing the heart. The heart is no longer pumping. When you are performing CPR, essentially the heart is not doing anything. You are the one who is now doing that, and your heart is beating all the time. So it's very important to remember that. It's very tiring, so that's why it's important to get some help if you can. And if a person's lying down, you can have one person on each side and you can swap in and out. In hospitals, we do tend to also have this big machine, which if CPR is going on for quite long, you can replace it, but it's it's a proper workout. Yes, that's CPR. So for adults, we do 30 compressions to 2 rescue breaths. Again, since COVID, people say that you don't have to do the rescue breaths, but if you want to, you can. So what that is you squeeze their nose and you put your mouth around their mouth and you take 2 deep breaths out. Well, you breathe it into their mouths, essentially. So you're doing that for them. So 30 compressions to 2 breaths is the ratio. But if you feel uncomfortable, you don't know the person, you think maybe there's something around their mouth, you don't feel comfortable or confident, then you can just do continuous compressions. For children, it's slightly different. I can speak about that at the end if you want to know that. But for children, it's a different ratio because of the problems that would cause a child to have a cardiac arrest. It's very rare for that to happen in a child, but they tend to have different causes, so you have different compressions. Okay. So again, interlace the fingers and pressing down. Now we go back to if the person is breathing. I think 2 people have said the recovery position, which is brilliant. So what that does is that keeps the airway nice and open, and if they are vomiting, for example, it allows it all to fall out without them choking on it. And if the tongue is floppy, it allows the tongue to fall forwards rather than outwards. Again, it's quite difficult to show you this, so I'm going to show you another video which explains how to do the recovery position. But as you can see on this photo, essentially the hand supports the head, and that keeps the head in the right position and allows everything to come out. And the knee stops the body from rolling over. So this is a very safe position for someone who is not responding to you, but they are breathing. This is when you do the recovery position. Can we please have the next video? Thank you.
Should be placed into the recovery position to help maintain the airway. To do this, kneel next to them on the floor. Remove their glasses and any bulky objects in their pockets, but do not search their pockets for small items. Make sure both of the casualty's legs are straight. Then take the arm nearest to you and place it at a right angle to the body with the palm facing upwards, like so. Take the other arm and bring across their chest and place the back of their hand against their cheek nearest to you and hold it there. With the other hand, lift the far knee up until the foot is flat on the floor. Whilst keeping the casualty's hand pressed against their cheek, pull on the far leg and carefully roll the casualty towards you and onto this side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the airway remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking the level of response until help.
And they tend to perform first aid, things like on high streets, at festivals, at different places, and they have lots of good courses as well and lots of brilliant videos on how to perform these things. So it may be useful. It's hard when you've just seen it for the first time, and it does take a bit of practice, but you can watch these videos on YouTube or by searching St. John's Ambulance as well. So now we've spoken about an unresponsive person. What are some of the problems that can lead to someone becoming unresponsive or unconscious? Can anyone think of some causes that might cause people to become unresponsive? Yeah, heart attack. Mm-hmm. Yeah, low blood pressure, that's a good one. Epilepsy, yeah, so if people have seizures, yeah. So I have lots of different medical emergencies. I don't know if we'll get through them all, but this is just the basics of what to do in these situations. And some of them can lead to people becoming unconscious, some of them don't necessarily, but it's useful to know what to do at home. And also when is important to call 999. I appreciate that it's very difficult nowadays for anyone to access healthcare. Even if you work in healthcare, it's not any easier. We don't have a back door to, for example, I don't have a back door to my GP, even though I'm training to become one. So it's, I think, quite important to know when is important to call an ambulance, when is important to go to hospital. It's important to know you're not wasting anyone's time. And, you know, as a healthcare system, we are here for you. So it's important to use the service and to ask for the help when you need it. So anaphylaxis, which is a severe allergic reaction. You may know someone who's allergic to nuts, for example, and they carry an EpiPen. The main thing to do is, I don't think it's very obvious here, but lie the person down. You raise their legs, because what you're trying to do is get all the blood flowing back towards the heart. If they have an EpiPen, you inject it into the outer upper thigh. Clothes don't matter, so you can inject it through the clothes as well. An EpiPen is adrenaline, and what it does is it helps in an allergic reaction. You should also be calling an ambulance crew as well, so you should be calling 999, because an EpiPen may not be enough. It's a small amount of adrenaline. People may need more. What's happened? I think it's zoomed out a bit. There we go. So you remove the safety cap of the EpiPen, you place the orange side of it on the thigh, and you push down for 3 seconds, so you push down quite hard. And like I said, this can be done through clothes. So this is what an EpiPen, there we go, looks like. You remove the blue safety cap, you hold the pen, you put it against the thigh, press down for 3 seconds, and you push down hard. And again, you call for medical help as well, so you call for an ambulance. So with anaphylaxis, that can also block off the airways. Essentially, people's throats and things can become quite swollen, and it can cause people to, unfortunately, go into that unresponsive cardiac arrest situation. So we do this to prevent people from getting to the situation I just spoke about before. Okay. So now choking. Signs to look out for. There are okay signs and worrying signs. I've split it up into. If okay signs are if someone's coughing and speaking whilst they're choking, that's okay, we're less worried about that. We still need to encourage them to cough, for example, and get out the whatever the object is that's in their throat. But we're less worried about this, and you can just keep encouraging the person to cough. Worrying signs, if you have none of the okay signs, if they are silent, they're choking but they're silent, we worry about that, because again, it means the airway's blocked. If you have breathing that sounds like snoring, that's also quite worrying. If the person collapses, of course. Or if they turn kind of purple or grey in colour, that's also a worrying sign. So again, encourage the person to cough, that's number one. Back slaps, first of all, we say. So you go in and up. You do it right between their shoulder blades, and you want to use the heel of your hand in and up very hard. You do that 5 times. If that doesn't work, then you do abdominal thrusts. These used to be known as the Heimlich maneuver, but we don't call them anymore because the Heimlich was a German Nazi, essentially, so we don't use that name. That's why you won't hear people saying that term. But it's abdominal thrust. So you put your arms around the abdomen of the person, and you put your arms together, hands like this, and you'll want to squeeze in and up because you're trying to put a lot of pressure through so that you can eject whatever the object is that's in their throats. So you try 5 of those. If that doesn't work, you go back-to-back slaps, and you just repeat until the object comes out, really. So the reason, again, I put those okay and worrying signs are because if they're still coughing, speaking, you have a bit more time, you can keep trying at home. Obviously, it depends on how worried you are, but if you notice any of the worrying signs, then you'd be thinking, call an ambulance. I'm sure at times we may have choked on something minor at home and we've never had to call an ambulance, but part of the reason why it's important to know is worrying signs are when you should be calling an ambulance, for sure. But if you are worried, you can always call for paramedics to come and help. Oh, and just to let you know, with children or young babies, we say that if you're sitting down, you can put them over your lap and put their head downwards because then gravity will help you. With an adult, you can just get them to stand up. And if you are by yourself and you are choking, it's painful, but what we advise that people do is if you have the corner of a table, you essentially have to try and hit yourself in this same area as well, so just below the breastbone, quite forcefully in and up to try and get that out. So if you're by yourself and choking, that's the best way of trying to get it up if you can't get support. Obviously, we hope that this never happens, but it's important to know what you can do. So with stroke symptoms, I don't know if everyone's heard of FAST before. I've put the first one on, but does anyone know what FAST stands for? Yep. Yes. And T is for? Yeah, time to call an ambulance. So essentially, facial droop. Oh, I've gone back. facial droop, arm weakness, and we say arm weakness, but it could also be sudden leg weakness, speech difficulty, and then it's time to call 999. With weakness, the thing that's important to remember, it's not when you're tired and you feel weak. Weakness means you physically cannot lift your arms. So if I asked you now to lift your arms, please could everyone just lift one of their arms? You can all do it because you've told your brain to do that. If I told you to do that and you physically couldn't, so your brain and your arm are just not connecting anymore, that's what we call true weakness. Not just you feel tired and it's hard to lift it or that it's painful, that's not the same. But true weakness, you don't have to have all of these things, but any of these things can be signs of stroke. Also, someone is newly confused or they're really off balance. So again, not just that you feel a bit dizzy, but you're kind of walking all over the place, stumbling like as though someone was drunk. Those are signs of stroke. You call 999. You need to get them to a hospital as soon as possible. I know lots of people say, oh, they can just sleep it off, rest it off. That's not what you want to do. To treat a stroke, you need to do it as soon as possible because actually in the first 3 to 4 hours is the best time to treat them with the right medications, essentially. If we leave it longer than that, the treatment options you have are limited. So, because a stroke essentially is a blockage in the brain, so you have those first 3 or 4 hours to treat that. Past that, you don't get the same treatment options as you would. And it's very important, like I said, within 3 hours. And don't give aspirin at home. I know that some people know that we do tend to treat strokes with aspirin. I can tell you a bit more of the reason why if anyone wants to know about it at the end, but do not give aspirin. That's something that the medical team need to decide. And like I said, if you want me to tell you the medical reasons why, then I can say that afterwards. But do not give aspirin. That's for the medical team to decide. Okay. Does anyone have any brief questions at the moment? No? Okay. So now chest pain, heart attack symptoms. So a heart attack is different from a cardiac arrest. And does anyone know the difference between a heart attack and a cardiac arrest? So a cardiac arrest is when the heart just stops. So like I said, when the heart stops beating and you need to perform CPR. However, a heart attack is, if you imagine your heart has lots of arteries around it, it has plumbing, so the heart itself needs blood in order for the heart to work. If there's a blockage in one of the arteries that serves the heart, that's what a heart attack is. So it's very painful. And people tend to describe these symptoms. You get a heavy pressure sensation in the chest. They might be breathless. They might be sweating. They may feel nauseous. And they may also have pain in the left arm and also into their neck or jaw. So if anyone has any of these symptoms, that's when we tend to consider or worry about things like a heart attack. You call 999. Again, don't give aspirin unless advised to by the medical professionals. Again, lots of people are aware that we give aspirin for heart attacks and strokes, but don't give it because there are certain reasons why you should or shouldn't, and that's for the medical team to decide once they've assessed the person. If the person has GTN spray, I don't know if anyone knows what GTN spray is. Some people have it at home. If you have something called angina, which is you get a squeezing pain in your chest, the doctor may have prescribed you GTN. If you have that already at home, you can have it. You give 2 sprays underneath the tongue, and that tends to help open up the arteries a little bit. Okay. And now, I know last week our talk was about diabetes, so this is just relevant again. Low blood sugar. Has anyone experienced low blood sugar in terms of actually checking it on their BM machine and seeing that it's below 4? Yeah. And how do you feel when you experience that? Yeah. You might be sweaty, dizzy. Mm-hmm.
Shaky, sweaty. Me, when my blood sugar is low, I tend to shake and I sweat.
Yes. And those are very common signs of having a low blood sugar, for sure. Some people get a tingling sensation in the lips, blurred vision. You just feel, I'm sure even if you don't have diabetes, you know what it feels like if you're really hungry. It's almost the same sort of principle. So if you are someone who has diabetes, you'll probably know what your usual range is of your blood sugar. But what we define as low blood sugar is if it's less than 4 millimoles per litre. So if on your machine where you kind of read your blood sugars with, if it's less than 4, that means it's low blood sugar defined. So you have something sugary to drink. You can have a can of Coke, for example, that is fine, but sometimes we need to remember we're used to nowadays being told to drink Diet Coke and things. Diet Coke is not going to help. It needs to be like orange juice, full-fat Coke, something that's quickly going to get sugar into you fast. Lucozade, exactly. Anything that has a bit more kind of sugar in as well you want to take. And then within the next 15 to 30 minutes, we say follow it up with something that's a carbohydrate, so bread, cookies, because all the things like orange juice, that's quick-acting sugar, but now we need to replace your background stores. So you have something like cookies, you have bread, and that will replace the sugar that you have. If you're not getting better, or the person isn't getting better, if their blood sugar's still low, or they still have symptoms, again, you call 999, because sometimes what people need is an injection, and it's an injection of sugar, basically, because they can't drink anymore, they're unresponsive. So we give them something called glucagon. Some people might have it at home as an injection as well, but it's rare to have it at home. Usually only the hospital crew or the paramedics have it. Now, high blood sugar. Again, this really only occurs to people with diabetes again. You only really know, you can still have the same sorts of symptoms as people with low blood sugar, but you only know once you've checked it. If your blood sugar level is above 15, then you should call 111, ask for some help. But if it's above 20, go into hospital, because I won't go over what they explained last week, but if you have diabetes and your blood sugar is too high, it's very dangerous. It can cause you to be very dehydrated, and it can cause all of the kind of arteries and things to shut down. Go ahead.
Aspirin, is that for just stroke people? What about those having a heart attack? Can you give, like if someone's having a heart attack at home, can you give them aspirin?
So that's one of the things that's difficult. Usually aspirin is the right treatment and people can give it. The reason that we say don't is because you need a medical professional to determine exactly what their symptoms are. If it's a heart attack, aspirin definitely helps. But when you're at home, we don't know for sure. Sometimes when people have severe chest pain, they actually don't have a heart attack. But what happens is the lining of the big artery, the aorta, has torn, and the person's bleeding, essentially. But it feels like a heart attack. If you give aspirin in that, they will bleed more. So the reason we say don't give it at home is because at home, we're lay people, and we don't know the difference between a heart attack or that other problem I described. So if you were to give aspirin and it was the wrong problem, you'd make it worse. If we knew for sure it was a heart attack, which the paramedics can diagnose, the hospital doctors, then aspirin is great. It is part of the treatment. So that's why we say don't. Unless you pick up the phone to 111 and they tell you, they go through the symptoms with you and they say give it, then you give it.
Okay, thank you.
That's why to be cautious. Thank you. Oh, it's gone off. Perfect. Now, sickle cell crisis, very relevant. If you have sickle cell, essentially, a sickle cell crisis can be severe pain in any one area of the body. You can have severe breathlessness as well, because sometimes people get a sickle cell crisis in their chest, and that can be really dangerous because, again, it stops their breathing. And there's also something called priapism, which is a bit of a sensitive topic, but essentially, it's when all the blood pools in males' genital parts, so they essentially have what is a medical erection, but it's extremely painful, and if it's not treated appropriately, then actually people can lose that organ. So it's very dangerous. People with sickle cell can have this. So if anyone has any of these symptoms, you go straight to hospital, you call 999, and it's very important that you let the healthcare professionals, when you get there, know that you have sickle cell, and that you have a pain plan. Sometimes you have a pain plan with your doctors. And I think it's quite difficult because in some places, we're quite lucky in London because most people have a good understanding of sickle cell. But if you're somewhere else in the country or somewhere people aren't aware of sickle cell, because again, it primarily affects the Afro-Caribbean community, then they may think people are medication seeking. And what I mean by that is sickle cell is so painful. People need strong painkillers. They need things like morphine and oxycodone and really strong opiates, really, really strong medication. So unfortunately, some medical professionals may just think that the person's just coming here seeking drugs, not realizing that actually the person has sickle cell and they really do need these strong painkillers. So I think it's very important that you kind of advocate and say that you have sickle cell and you need strong painkillers, because unfortunately not every medical professional is that aware of this. So priapism is what I just explained. So essentially it's where essentially all the blood pulls into the male genital parts, and they essentially get a medical erection. They have an erection, but it's not pleasurable. It's extremely painful, and they can't stop it from going back down because the arteries, all of the kind of blood supply, it basically gets stuck because the sickle cell blood cells get stuck in the wrong place. And it lasts for hours, but it's extremely painful. It's not a nice experience at all, and it can cause that essentially the genital to die. So we need people to get to hospital. And it happens actually in younger boys as well. So if you know anyone with sickle cell, it's an important thing to know about. So Women don't get the same issue because our genitals just aren't shaped the same, so we don't tend to have that. But you can have a sickle cell crisis anywhere in the body. You can have severe pain in the arm, for example. You can have severe pain in the chest, because what's happening is all the sickled blood cells, which are the wrong shape, blood cells are supposed to be like a donut shape, but in sickle cell, they are crescent-shaped. So as you can see, when they go past all of the kind of little tributaries and the kind of blood supply, they get stuck there, and it's very, very painful. And that's what happens. But in women, we don't tend to have the same exact problem. Any other questions about that at all? No. And then asthma attack or struggling to breathe. This is also relevant for people with COPD. COPD is a condition which, to make it sound simple, but it's not really this. It's almost like asthma, but for adults who have smoked over a long period of time. So they will often also have inhalers. They have inhalers like the blue inhalers that you give children with asthma. Again, that's a much simplified kind of view of it. That's not really what COPD is, but it's a long-term breathing condition mostly that occurs in smokers, long-term smokers. So if someone has an asthma attack, you sit them upright. If they have a blue inhaler, give it to them. The way you do that is you essentially get them to blow out. You have to make a tight seal around the mouthpiece with your mouth, so don't let there be any gaps. And you start pressing the inhaler, and you take deep breaths in and really want to inhale that into your lungs. Now, you can repeat that up to a total of 10 puffs. So you give 2 puffs at any one time, and if someone's still breathless, you can do it up to 10. But what we're saying is, usually 2 should help, maybe 4. If you're getting up to the point at which someone requires 10 puffs of their blue inhaler, that's dangerous. Their lungs are not really responding very well. So again, we call an ambulance crew. Because again, we want to make sure that their lungs are working properly and we don't get into the situation where someone's unresponsive and we're doing CPR. Breathing is very important. Remember in ABC, it's the second thing. So yeah, don't be afraid to call 999 if someone is struggling to breathe. And if they don't have a blue inhaler and they're struggling to breathe, you call 999, and they can obviously redirect you as well. Now, seizures or epilepsy we spoke about as well. Someone mentioned that. First of all, you lie the person down. You essentially have to set a timer, and that's a little bit important for later. The reason why you do that is because if a seizure lasts longer than 5 minutes, that's very dangerous, basically. A seizure, if someone has epilepsy, they may still have seizures, but it should stop by itself within 5 minutes. If it doesn't stop by 5 minutes, they need some real intervention. They need, again, paramedics to come right away. You shouldn't actually put your hand inside their mouth. I know some people do, but we advise not to because, again, the tongue can go the wrong way. Or when people are seizing, they're not in control of their body. They can bite down extremely hard. They can damage your fingers because they're not in control. You attempt to put them in the recovery position if it's safe to do so, if you can and if it seems appropriate. If not, you just have to remove any dangerous objects from nearby, especially near their head. Remember, if there's any shelves or things as well, remove anything and let the seizure end by itself. Seizures can also happen in young babies as well if they have a really high temperature. I don't know if anyone's ever experienced that before, but I've worked in A&E before, and also we get taught about it all the time, but I've seen so many young children who've had a seizure because of a high temperature, and it is normal. What I mean is it's not uncommon. It happens very, very commonly. It doesn't mean they're going to develop epilepsy, but it's because they've had such a high temperature and their body's getting used to it for the first time. But if you see a young child having a seizure, do all these things, call an ambulance crew. You don't need to determine whether or not you think this is normal or not. You bring them in as well to hospital. So that's seizures. A bleeding wound. We're almost at the end now. So if someone has a bleeding wound, you sit or lie the person down. That's very important, because if someone's running around in a panic, their heart's pumping faster, they're bleeding more, they're gushing out of that wound. So sit them or lie them down. You examine it, have a look at what's inside. Don't remove any objects yourself. 2 reasons for that. One is it's dangerous. And number 2, actually whatever's in the wound may be applying pressure to the wound and stopping blood from coming out. If you take it out, you can imagine you kind of just take it, letting the hose run. So don't remove any objects yourself. And you want to elevate the wound above the level of the heart. What that means is, wherever the wound is, you want to move that above the level. So if I had it on my hand, I'd have to hold my hand up. People try and bring their hand back down again because they're tired of it and they'll start getting, cramp. But you have to literally hold their hand up because you're trying to get the blood all flowing back to the heart and not pumping out. If it's the leg, you lie them down and you move it above the level of the heart. If you have any wound in the middle of the chest, it's difficult. You just have to lie them down because you can't really move it any higher than the heart. You apply pressure, a lot of pressure. They can either hold it with their hand or you can tie lots of things around it. Anything you have, clothes, anything that's clean, you apply. pressure to it. But if there's something inside it, like a big knife, you obviously can't really apply pressure on a knife or around the wound. We say you tie a tourniquet. Has anyone ever had to tie a tourniquet before and know what they look like? Yeah. So a tourniquet, it's the same thing as when you have your blood taken, right? They put the tourniquet above your arm, and then they essentially put the needle in. You can use anything for this. You can use a tie, you can use a belt, you can use a strip of material, and you just want to tie something really tightly above the level of the wound. And that's, again, to stop the bleeding. Now, dizziness or simple faints, if someone feels a bit dizzy, you lie them down. Lie them down, preferably on the bed or a floor, and you raise their legs, because what you're trying to do is get all the blood flow back to the heart, back to the brain as well. And you do this until they kind of feel better or they wake up again. You can obviously see the airway breathing. If they're breathing, if they're responding to you, then you know it's just a simple faint. If they're not, we go back into CPR, that whole principle, CPR or recovery position. And now this is, I think, the last one. So a mental health crisis. I'm not sure how many people have dealt with a family member, for example, or someone else that they know who's experienced a mental health crisis. They do happen. They happen in every community. Again, not my uncle, but my dad's one of his very good friends had a mental health crisis and was admitted to a mental health hospital. It happens regularly, but people don't like to talk about it as well. I'm originally Nigerian, and both of these people that I've experienced are both Nigerian, and I know that we tend not to want to speak about these things. But he's doing a lot better now, actually, a lot better. He's been kind of discharged a long time ago, and things are a lot better for him. But some of the signs, maybe someone's not behaving their usual self, very erratically. They're having really strange beliefs that you think just don't make sense. They're behaving violently, for example, again, just abnormally. Or if they're attempting to harm themselves or end their lives. We don't want to talk about it sometimes, but we know that people do have these thoughts, and sometimes people do try to do this. How to help? You can stay with them, keep them calm, or keep them talking. Now, if they have a dangerous object on them, like I said, danger, don't try to remove anything from them. And you call 999 if you think they're just about to hurt themselves, if they're by a train track, if they have a knife, something like this. But actually, does anyone know about the mental health crisis line? So this is 111, option 2. If someone's really at risk of harming themselves, but they haven't done anything physically yet, or they're just behaving really, essentially, abnormally, and you're just quite worried about them, you can call 111, and they'll usually redirect you to option 2. That's the mental health crisis line, so that's quite important as well to just bear that in mind. Or if they're willing to go with you, you can take them to A&E. A&E, I know it's busy, no one likes to go, but it's considered a place of safety. So what that means is if someone is really at risk of harming themselves, harming someone else, we're really worried about them, A&E should always be a place where someone can be taken to because they need medical help, really. That's what it is. So it's not unreasonable to take someone to A&E if you're really worried about their safety in any way. So now we're just going on to general looking after yourself. So we've gone through all the medical emergencies. I'm sorry, I know it's not the nicest topic for anyone to listen to on a Saturday afternoon, but I hope that it's been helpful. So advocate for yourself and your loved ones. You can almost always, there's pretty much never a reason why you can't take someone else with you to a medical appointment, whether that's your daughter, your son, your family friend, whoever you trust, take them with you, and then you can speak to the medical professional yourselves. You can question healthcare professionals if you are unsure. You are allowed to question healthcare professionals because healthcare professionals are here for you and to help you, and it's your body. So we try to make decisions with you. I know sometimes people don't necessarily believe that, but that's what the goal is. It's your body, really. We're just here to support you. You can write questions or comments down before you go to your appointments as well. So if you have questions, write them down and speak to your doctors about them. Regular health checks. I know it's hard for people to see their GPs, but if you have things like diabetes, I'm sure they'll be sending you annual appointments. So attend your appointments, and then you can find out what's going on with, for example, things like your blood sugars. Take your medication as prescribed. Again, so long as you're relatively satisfied with your medication, it's important if it's prescribed to you to take it as it's prescribed as well. But like I said, it doesn't mean you can't question your doctor regarding those medications or the nurse or whoever it is that's giving it to you. But it's just important that if you are prescribed something and you've agreed to taking it, it's important to take it as prescribed so that you're not causing harm, because some medications, for example, epilepsy medications, if they are stopped suddenly, it can cause very severe seizures. So that's why it's important. But again, you can question your healthcare professional always. First aid training. I've just spoken through things very quickly, and I'm aware that I speak quite fast as well. But you can always sign up to first aid training, and it's important to know. I wish we had more people more people here that we could explain this to and actually advise on how they could do it, but you can sign up to first aid training. And call 111 or 999. Especially 111, they're there for advice, so you can always call them if you're not sure. And if it's a big emergency, you're panicking, you don't know what to do, you can call 999. So these are some useful links. Again, St. John's Ambulance, they're brilliant. British Red Cross. The NHS website as well is very good because when you go through it, it tells you all sorts of conditions, and it kind of explains to you the symptoms, and it also explains your medication. So go onto the NHS website and type in your medication, and it should say the side effects, when you take it, when speak to your doctor, and it's a verified website. So please do use the NHS website if you have any basic questions initially. Thank you. Any questions?
Okay, two things here. With the mental health, someone of mental health, yeah, and you know, you call the 112 or 999, and they come, they just leave them. They don't even. So you are at risk. They don't. What should I say? That person should be taken to A&E or somewhere to get help, but they just leave them because they see that maybe that person don't need it. But we do know because we observe and see what the person has done, which is not normal.
Yes.
But they don't, they just leave them.
Fine. So if I think I'm getting the question correct, I think what you're saying is that maybe you know, sometimes people might know someone, live with someone, or work with someone, and over a long period of time you recognize that that person's not themselves. But you've called the ambulance crew or someone like this, and they've seen them and said they're safe to stay at home. In those situations, there's a few different things that you can consider doing. Like you said, if they're willing, you can take that person to A&E, and again, just say, you've had this person assessed, but this is what you've noticed. I know it's difficult to get GP appointments, but if you can also state that. Or you call again, and you say that these are the things you're worried about. Sometimes with the ambulance crew, what they may do is they're assessing a situation immediately. So they're seeing, is this person immediately going to hurt themselves or hurt someone else? And they see, no, they're not going to, okay, we don't need to take them in. That doesn't mean the person doesn't have a problem. What it means is then we just have to push a bit harder. And I appreciate it's probably very frustrating when you're the person who is staying with them and you know what they're like, but you just have to keep pushing and keep writing it down, for example, if you can. Even if you write down that on this day the ambulance crew came, said they were okay, you try to call the GP, you call 111, you take them to A&E. A&E is a good place, although it's busy, because at least then the person's getting assessed by a medical professional, and you just have to keep saying what what the issue is that the person's experiencing, and then hopefully they can be admitted in to hospital if they need it, or get the right treatment that they need. So sometimes it's just, again, advocating for yourself, like I said, and your loved ones, which is not easy.
How do you treat pseudo-fit?
Pseudo-fit. So someone who has something like dissociative seizures or functional. So that's difficult. If someone has a seizure or fit, you still have to do the same things in terms of keeping them safe. But do you mean in terms of like background medication and how to treat it? It's difficult. They need to be seen by a neurologist, which is a specialist that knows about epilepsy. They make sure that the person does not have epilepsy. And often with that condition, it tends to be what we call functional. So in medical health, we can't find a reason why they're having it. We think it's often more related to, for example, emotional issues. So that person may have had lots of stress, for example, when they were younger, or been through lots of extreme situations, and that's caused them to present with having, for example, lots of pseudo-fits. So then they need to have things like psychiatric or mental health support as well as neurology support. They need the two together, because if we can't find a medical reason at the moment, or the neurologist can't, that's what they need for pseudo-fits.
How do you treat someone with a nosebleed?
With a nosebleed, I didn't talk about that actually, yes. So with a nosebleed, essentially, you lean them forwards, you should pinch the soft part of their nose, and you ask them to lean forward. You can, if you have ice packs, you can put ice around there as well. It should start to stop by itself within kind of about 10 to 15 minutes. We say don't go back actually, because if you go back, the blood trails down the throat. So we say go forwards across a sink. Yes, and they shouldn't. You should go forwards because you're trying to get the blood out. Because when you have a nosebleed, the bleeding is specifically from here. It's in this area, so you want it back, not forwards. Again, ice can help because it helps to compress the vessels. And if it continues, you can go to A&E. In A&E, I mean, like I said, if it's 15, 20 minutes, it's not stopping. they are used to seeing nosebleeds. Again, I've seen it, it helps as well with it. And they put things that are thick cotton buds. So again, essentially they look like women's kind of menstrual products, like tampons, and they put them into the nose. They're specifically designed for this, and those are used to stop severe bleeding. So yeah, that's the answer. Anything else? Any other questions or comments? Thank you. Thank you.
We're sitting here in silence and shock. What? Let's give our colleague I'm sure we've been educated. So as we go through those doors, hopefully about to put some of the practical lessons that Dr. Fowler has presented us with today in action, we could be the difference between life and death. Don't be hesitant, don't be afraid. You know, once you find yourselves in that kind of situation, take a deep breath and put some of the information that Dr. Fowler presented to us in action. So I guess on behalf of Ilford Central, Dr. Fowler, thank you very much for coming. Your expertise, thank you. Yeah, I can say that your presentation was insightful and powerful. I can also say that you've actually equipped us with a degree of, a lot of confidence in terms of if we were to encounter something like this, we've got a modicum of knowledge to be able to use to ensure that the person remains alive long enough so that, say, an ambulance can come and support you to convey them to hospital. For those of us who came this afternoon, thank you very much. Next week, we've got another powerful presentation by Sister Monifa and her team. They'll be here speaking on homeopathy. Is it a fad or is it fact? So at 4 o'clock next Sabbath, we'll be here again with another presentation in the series, Fact or Fad, Homeopathy, by Sister Monifa Dowley and her team. Shall we stand? And this time I'll ask Brother Nicodemus to send us on our way.
Let's bow our heads as we pray. Father in heaven, we are indeed thankful for you being with us throughout the day. Thank you, O Lord, for the knowledge that you have imparted unto us. May you help us that we'll use it to the benefit of ourselves and also to those who may come across. So we pray, O Lord, that you be with us as we depart from this place, that your Holy Spirit guide and direct us. In Jesus' name I pray, amen.
Amen. Thank you. Nico.